position. So atlas is a thumb contact. Okay, this is Gonstead. And so I'm going to stand outside the chair, meaning that one of my legs is outside the chair. My leg's going to be within the chair. So I need to be able to lean forward and not push your head away. My contact point is going to be on the atlas TP. My hand is in this position. This is a thumb contact on the atlas transverse process. And so lean the patient's head over. This would be for a right listing. Let's say an ASR. Okay. I'm going to drag some tissue. All right, I want to get on the anterolateral aspect of the transverse process. Okay. Put the patient's head back in a neutral position, and I'm going to take my support hand. I'm going to slide down. My thenar is kind of on the zygomatic arch, and my fingers are wrapped around the back of the patient's head. So my arm is in this position. Can you see the rectangle? The rectangle with my arms. And so I want the patient's head in a neutral position. I'm going to laterally flex, and then the thrust is going to be lateral to medial with a little bit of a superior torque. Okay. What I want you guys to do is make sure you just bring the patient's head against the side of your body so that the patient can relax. And she'll just kind of let her head relax. There you go, perfect. And the thrust is going to be just a lateral to medial thrust. Okay. So the line of correction is actually lateral to medial and S to I. If I have an ASRA, okay, I'm going to rotate the patient's nose towards me. Okay. Notice that my adjusting arm is still in the same position, so I pivoted on the contact. Now I'm on the anterolateral aspect of that transverse process. When I make the thrust, I'm actually going to thrust a little bit A to P. Right. My thrust is the same. The line of correction is now a little A to P. For a posterior listing, I'm going to rotate the patient's nose away, okay, and I'm going to thrust the same way. Now I'm on the posterior aspect of the transverse process, and so that would be for an ASR. Okay. Remember the torque, superior torque, inferior torque. Superior torque is for the superior listings. Inferior torque is for the inferior listings. So, and we're not torquing like this. It's just a small amount of movement. The lower cervicals, I'm going to make my contact on the spinous process first. So I'm going to stand behind the patient, and the way we're going to do this is I'm going to turn my body just a little bit. If I'm going to contact the right side, I'm going to turn my body so that so that my right shoulder is back. If it's a left listing, I'm going to turn my body so my left shoulder is back. So I'm going to stand with my right shoulder back. I'm going to flex the patient's head forward, and I'm going to find the spinous process. My hand is going to be in this position. And so I'm going to find the spinous process. I'm going to hook my contact up underneath the spinous. And then I'm going to reach around and I'm going to grab the patient's chin. Okay. Bring the patient's chin in. Okay. And I'm going to extend the patient's head back until I feel that spinous process move. And I'll lean the patient's head over until the patient's head touches my thumb. We want to create that little rat hole there. Okay. And then I'm going to take this hand like this. I'm going to lean forward a little bit to allow her head to just rest on my body, and the thrust is going to be straight P to A, okay, just like that. It's going to be P to A with a little bit of a lift, okay. The lift is just lifting your fingers up. That's all you're doing, okay. So what you're doing is you're making that thrust and lifting that segment back up onto the disc, okay. That would be for a right listing, okay. Left listing would do the opposite. If I want to do a contact on the lamina, I'm just going to slide out onto the lamina, and everything else is exactly the same. So this would be a PL-L. I'm sorry, a PL-L. I'm on the right lamina. Okay? And so I'm going to flex the patient's head forward. I'm going to slide out onto the lamina. I'm going to find the patient's chin. Okay? And I'm going to bring the chin in, stacking the vertebrae. Bring that segment back until I feel it move. Feel that lamina move. I'm going to laterally flex the patient's head until their head touches my thumb. Okay. And I'm going to support just like this. Okay. And the thrust is again on the lamina, and it's going to be the same way. I'm going to thrust with a little bit of a scoop, a little bit of a lift. Okay. All right. Questions about